LA Healthcare, the largest care organization in the state of California, the largest in the nation's publicly operated health plan, was fined $55 million for failing to authorize care to thousands of poor and at-risk members, causing health-threatening treatment delays, the California regulators announced on this past Friday. The fines, by far the largest in the state, were levied against the Los Angeles County Health Plan by the State Department of Managed Healthcare and the Department of Healthcare Services. Quote, "The scope and the breadth of its violations indicate deep-rooted systemic failures that threaten the health and safety of its members." This comes from Michelle Bass, the director of the California Department of Healthcare Services. In one case, a cancer patient was left without treatment despite deteriorating health. Another plan member suffered extreme pain for over 2 weeks, and another cancer patient who was given only 6 to 9 months to live left the plan for another insurer because of delays, the agency said. Quote, "My hope is that this sends a strong message to the entire industry that the state takes very seriously protecting all consumers, but particularly our most vulnerable enrollees," close quote. This comes from Mary Watanabe, the director of the Department of Managed Healthcare. LA Care, also known as the Local Initiative Health Authority for Los Angeles County, has about 2.5 million members, making it the largest Medicaid plan in the state. Many of its members are low income and rely on county hospitals, although some have access to private doctors. The state regulatory agency said their investigations were prompted by an article that was published 2 years ago in the Los Angeles Times, which noted that patients seeking specialty care with a referred primary doctor from a referral with their primary doctor had to wait months for approval instead of the required 15-day limit for a health plan to offer their appointments. Some patients died in the meantime, the Los Angeles Times reported, including a 61-year-old woman with chronic kidney disease who waited 10 months to see a specialist. The plan disclosed last year that it had a backlog of thousands of requests for authorized health care services, and that it found that nearly 93,000 of those cases in which had failed to process such requests in a timely manner. The health plan also said that it failed to issue resolution letters in the time required for tens of thousands of grievances filed by its members from 2019 to October of 2021. In a statement, LA Care said that it identified as a self-reported problem and that it had taken care of it and had taken corrective actions, including agreeing to pay an independent but approved by the state monitor to make sure that it met the state's requirements as quickly as possible. The backlog of grievances will be resolved this month, LA Care says, and they also said that it will contest the fines, calling them arbitrary and unnecessarily punitive. Closed quote. For Headlines with a Voice, this is Felicia Lockhart.